Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. When a child is found to have autism, parents naturally wonder if they did something that caused it. I'll be talking about that with Dr. Lou Pellegrino. He's an associate professor of pediatrics at Upstate, specializing in neurodevelopmental pediatrics. Welcome to the Informed Patient, Dr. Pellegrino.
Thank you. Thanks for having me.
I'm sure you get this question a lot about what causes autism or what doesn't cause autism, but let's start with a definition of what autism is.
We think of it as being a general term as a neurodevelopmental condition. So there's a number of different things that usually arise in early childhood. Other things that would fall into that general umbrella would include things like attention deficit hyperactivity disorder, learning disabilities, intellectual disability. The thing that distinguishes autism from these other things is that children have specific characteristics, especially related to difficulties that they have with communication and socialization on the one hand, and difficulties that they have with characteristics of their behavior that sometimes people refer to as behavioral rigidity or repetitive behaviors. And that combination of things, we tend not to see in children that predominantly have problems like delays or problems with an attention or impulse control, like children with ADHD. That's sort of what stands out in autism. Actually, the official diagnostic term we're using these days is autism spectrum disorder. And it kind of arose over a recognition about that there's a fair amount of variability in how autism presents. So, for example, when I started seeing children with autism about 35 years ago, actually, and back in those days, I think we mainly thought of autism as being kind of rare, and specifically children that had more severe manifestations. So we would see mainly children that were nonverbal, that didn't show much interest at all in interacting with people, and didn't show much in the way of typical play behavior, for example. But over the years, especially during the late 90s and early 2000s, we began to recognize much more that there was a lot more milder or variability in the manifestations of autism. So, for example, like we often see children who we diagnose with autism, but they're actually quite friendly. They're actually very interactive. They're interested in interacting with people, but they still have trouble with the social aspects of communication and with being able to relate with people the way that we would expect them to based on their age. So it's kind of the whole idea of the spectrum. It's kind of like the rainbow of, that there's like a wide range of things and there's a lot of variability, which actually can be challenging for us to try to determine if the child is falling under that broad umbrella of things or not.
What percent of babies born will have autism?
So we can't diagnose it at birth, but as they get older, we can determine sort of what they call the prevalence, which is how frequent it is in the population. So it's our current estimate is about 3.2% of the population would be able to show signs of autism, or 1 in 31 is the other way that people would describe that.
And what functions does autism affect, or can autism affect? Because I understand it's individualized.
It's very much individualized. I would say the big things I mentioned a little bit already would be problems, first of all, with communication and social interaction problems. So, for example, it's really common for children to have speech delays. And most of the kids that we see with speech delays don't have autism. The thing that really stands out with children with autism is a problem with social communication. So, for example, children without autism, if they're not talking yet, they'll usually find some other compensatory way to communicate. A lot of times it's pointing. So they'll use a lot of body language and they'll use a lot of eye contact to get people's attention, to show them what they want. Children with autism have a lot of trouble doing that. They'll try to find other methods to communicate, like just bringing people, dragging them and pulling them to things, but they have trouble kind of sharing experiences with other people, which it makes it very hard for them to communicate early on, especially. And that's kind of closely related to the problem that they have with making social connections with people. It's sort of like the idea, the kind of foundation of all social connection that develops in early childhood is being able to share experiences with other people. And that seems to be a fundamental problem that they have. The other aspect of autism relates to some of the challenging behavioral traits. So a lot of the children with autism have a lot of trouble with change. They need things to be very predictable. So they tend to be very routine oriented. And they get very upset sometimes if their routines are upset or if their expectations are upset. And they also have a tendency towards getting a little over-focused or repetitive in some of the things that they're doing. It shows up in their play. It shows up in their daily routines. I would say, probably the truth of it is that all of us have a little bit of these sorts of things in our lives that we could recognize. And a lot of parents will tell me that they see traits in their children that remind them of themselves. But with children with autism, these traits tend to be more dominant, tend to make it hard for them to do other things that we would like them to be able to do.
At what age is autism typically diagnosed, and how do you go about diagnosing it?
I would say that the age that it's typically diagnosed is during the preschool years, but it can be diagnosed earlier than that. And we're trying very hard to be able to get children in earlier, to be able to do those earlier diagnoses. I would say it's a little hard to diagnose it before a year of age. Usually the characteristics really kind of emerge more clearly between a year and 2 years of age. So we're hoping that we can get the kids in as early as like 18 months or 2 years of age if we're seeing signs of it already. But I would say typically it takes a while for kids to actually get in for a diagnosis. And so a lot of times they don't get diagnosed till they're 3 or 4, or sometimes older. We'd like to be able to do better with that.
How important is early intervention, and what difference can it make?
A lot of difference. Early intervention refers to the types of interventions that people do, like special education services, speech language therapy, occupational therapy, physical therapy, special school programs that provide services, especially what we call integrated preschool programs. There's a lot of evidence that those types of services make a big difference in how well these children do. It doesn't make the autism go away usually, but it makes it a lot easier for these children to become more functional. And really, it's true, the earlier the better. If they can start earlier, it has a bigger impact on how well they do in the long term. So there's always a big push to that. And I would also underline that the interventions that we know really help children with autism are not medical interventions. They're really educational and therapeutic interventions. And those are the things that we're always advocating for and really pushing for.
Because there's not a medication.
No, I wish there was. That would be lovely, but it's really not that type of a condition that would respond to a specific medication. It's actually much too complex, actually, that you could expect one medication to do something like that.
Well, what is the outlook through adolescence and into adulthood for someone who has autism?
Yeah, I think it's actually remarkably positive. It does depend, because of the variability of autism, it does depend to what degree the person's affected and how severe the conditions are. But I would say I've seen so many children over the years, a lot of times when they're younger, like 3 or 4 years old, and they're initially diagnosed, some of them are not talking yet. A lot of them are not very interested in interacting with other people. And pretty much, I would say 100% of them improve over time. And I've seen enough of them when they've gotten older, they've graduated from high school, some of them have gone on to college. I think that there's a lot of challenges along the way for that to happen. But I've learned to give them a lot of the benefit of the doubt in terms of what the outcomes could be, because I've been surprised many times, and many parents have been surprised many times.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with pediatrician Dr. Lou Pellegrino about autism. How do you answer when parents ask what causes autism?
So we think the causes are really complicated, but we know that genetics plays a big factor. So, for example, one of the ways that people, when they're trying to determine, scientists are trying to determine how much genetics has a role, they'll do initially things called twin studies. So they'll look and see if you have identical twins in the same family, what's the likelihood that if one has autism, the other would have autism. And the studies that have been done with autism, it's very high. So if it's an identical twin situation, 98% of the time, if one child has autism, the other child will have autism. So in the same family, if you have one child with autism and another sibling who's not an identical twin, are you looking for the signs of autism? It's somewhere around 10% likelihood. So it dropped down quite a bit. But what those kinds of studies show us is that there's a strong tendency for autism to run in families, which is based on the genetics of the family. We don't always know what exact genes are involved in those situations, but we know that there's a strong tendency towards that. The other aspects of genetics is that there can be specific gene changes. In particular, children, they're called mutations, that can be tested for, and we often do test for those. There's been a number, like hundreds of genes actually, that have been associated with autism or increased risk of autism. So there's not really any one particular gene. There's like multiple different ones that we can evaluate that for. And those might run in families and they might not. They might be just out of the blue and happen in just one child at a particular time. The thing that makes it complicated is that there probably also are some environmental influences. So we think like the way the genes work is mainly during the fetal development or during pregnancy. So the genes are kind of like the blueprint for brain development. And brain development is what's really important in determining whether somebody ends up having a propensity to autism or not. And the genes can be affected by other factors during the pregnancy. One of the things that we know is children that are born premature or children that are low birth weight have a higher risk of autism. So it's something like we were saying earlier that the rate of autism in the population is about 3%, a little bit more. For children that are born extremely premature, it's about 7%. So it's not that if you're born premature, you're going to have autism. It's just that it increases your likelihood a little bit. But if we're saying 7% of extreme premature babies can end up having autism, that means 93% won't. So it's more of a probability of a risk factor. Some of the other pregnancy risk factors is maternal health. If mothers have certain health conditions, particularly like autoimmune conditions, if parents are older, actually, the father or the mother, increased maternal or paternal age has been associated with a slight increased risk of autism. Some specific drugs, especially some seizure medications, have been associated with that. But I would say just in general, healthy pregnancies are kind of protective against autism. It doesn't control for all those genetic factors that we're talking about, but it's important.
Let me ask you, I know that autism isn't diagnosed immediately at birth,
Right.
but are babies born with it, or are there environmental factors that the baby may be exposed to
We
that
actually think that the environmental factors are really during the pregnancy, if there are any, and not so much after the baby's born. So, people have looked really hard at that too, that worried that there might be some triggers that occur after they're born, but it hasn't really borne out. It seems to be the big critical period is during pregnancy itself. So healthy pregnancies are kind of what we're focusing on a lot when we're trying preventative strategies for autism. One of the big things that comes up a lot is whether things like vaccines, for example, might be a potential trigger for autism. We've actually had a ton of really good research about that over the last several decades, and it's really been disproven that there's any link between vaccines and autism. So we know that those don't cause it or trigger it. And we don't have other specific environmental triggers that we've been able to identify for autism other than some of the things that we were talking about during pregnancy.
and we talked about some of the risk factors for developing autism, but are there ways to prevent autism? Is there anything that's been shown to have an effect?
So I would say, in terms of the pregnancy issues, it would be having a very healthy pregnancy, avoiding things like alcohol and smoking, of course, during pregnancy, avoiding using any kind of drugs or medications that you don't need to take during pregnancy. Very good prenatal care would be really important. Trying to make sure that the pregnancy is monitored closely so that you could take it to term because of the concern about prematurity and pregnancy. Maternal health, healthy moms and healthy pregnancies make healthy babies, I guess, is a way of putting that. And I would say that's very protective with regard to this autism, or not just autism, other neurodevelopmental problems as well.
So what do you say to parents who feel like, they did something that caused this?
Really, most of the time, there isn't something that you could pinpoint that way. Some of it is a little bit out of our control. It's actually a fairly common issue. So most parents and most families know that there's other folks in their families or people that they know. Some of it is a little bit a matter of chance, but most of the time when I talk with families about what their experience during pregnancy, during the child's early development, usually I can't pinpoint specific things, and it's not really very fruitful to focus on that because we can't ever prove it if there's a specific thing that parents do. I would say most of the time I tell them that I don't see any evidence that there is any specific thing that they did. And even the things that we were talking about, like risk factors during pregnancy, they're not things that cause autism. They're things that may slightly increase the probability of it. So how do we prove something like that? You really can't.
Is autism more common now, or is it just more likely to be identified?
Probably more likely to be identified. I think we've gotten much better at recognizing the spectrum. We talked about that earlier. And also that I think that the general population, people out there are much more aware about autism. I know that for a fact. When I started doing this, people didn't even know what it was. And now people are very savvy. I personally think that part of the reason that we saw such a big increase in the diagnosis during the late 90s and early 2000s is because of the internet. People just became much more aware of the information. The information became much more accessible. People are much more educated about it. Most of the parents that come in to see me, they kind of already have diagnosed the kid themselves. They've actually figured it out from looking at all the information that they've read about. And a lot of it is me kind of confirming their suspicions. So people are very savvy about it these days. And they also are savvy about the fact that there's a lot of variability. Most people know the spectrum concept. And they also know examples of folks that are, as adults, have been very successful and have kind of grown up with autism themselves. And I also mentioned this earlier, but I've heard an awful lot of parents that have told me they think that they have it themselves and that they can recognize some of those features when they were growing up, and they have families and they have jobs and they've learned to function with that. So, I think it's just because of those things.
Well, Dr. Pellegrino, thank you so much for making time to tell us about autism.
Thank you. Thanks for having me.
My guest has been Associate Professor of Pediatrics Dr. Lou Pellegrino from Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.